We are living in an unprecedented time, a global pandemic and a fentanyl poisoning crisis that is taking a significant toll in urban and rural and remote communities in British Columbia and right across Canada. Last month, a staggering 175 people lost their lives due to fentanyl poisoning of drugs on the street. They are our aunties, our uncles, our cousins, our sisters and brothers, our children, and our dear friends. Some were young people with bright futures ahead of them that were snatched away because of fentanyl poisoning of the drug supply on the streets. I have sat with parents who have lost children in this overdose crisis. I have heard the heartbreak and the anguish in their voices and the pain that they will live with for the rest of their lives. I've also heard about how they knocked on one door after another, trying to get the help and the support that their child needed. And now we have one public health emergency on top of another. And that is taking an enormous toll on young people and on their families across BC. For too long in this province, youth who were struggling with addictions had to face long wait times for care. And the options for substance use treatment and care were also very limited. That's why building more healing spaces, building more ways, more access points for youth to get the help that they need to cope with addictions is more important now than it ever has been before. Between January and June of this year, 60 young people under the age of 24 lost their lives in this fentanyl poisoning crisis. 60 sons and daughters whose lives were cut short because of a poisoned, illicit drug supply. Last week, we announced the opening of Traverse, a new 20-bed youth treatment center in Chilliwack. Before that, there were only 104 youth treatment beds in all of BC, a combination of withdrawal beds, residential recovery beds, and highly specialized youth treatment beds. 104. In fact, under the previous government, the number of youth treatment beds actually went down by 25% at a time when overdose deaths were going up. Today, I am thrilled to announce that our government is more than doubling the number of youth treatment beds to young people struggling with addiction right across British Columbia. We are committing $36 million over 2.5 years to fund 123 new addiction treatment beds for youth and young adults aged 12 to 24. These beds will include withdrawal management and detox spaces where youth can get the medical attention that they need to manage withdrawal and to begin their healing journey. They will include residential recovery beds that will offer a much-needed safe haven from challenging and high-risk living situations for youth, and it will include highly specialized treatment spaces which can include 24-hour psychiatric nursing care and support. But whatever the option is, it will be safe, it will be linked to a continuum of care, and it will be connected to culture and to community. There is nothing more pressing than every young person in this province getting the supports that they need, not just to survive, but to thrive. And today, we are taking a historic step forward to making that a reality for youth struggling with addiction across BC. With these 123 new beds announcing today and the 20 new youth beds announced in Chilliwack last week, we are adding a total of 143 youth treatment beds, the largest investment in youth addiction treatment in this province ever. We are working with health authorities and with the First Nations Health Authority to ensure that those beds will be placed in communities where the need is greatest, right across the province. We know that there are critical gaps in services for youth, and we know that health authorities will be working with us around the clock to expand existing facilities and to create new spaces so that these beds can be available quickly because they're needed quickly. Providing the right substance use services at the right time and close to home is absolutely critical. Just over a year ago, Premier John Horgan and I launched a Pathway to Hope, a 10-year plan for better mental health and addictions care in British Columbia. And our primary focus is on going upstream. Our primary focus is on prevention. It's on improving mental health and wellness for children, for youth, and for young adults. Because we know that addressing small issues before they become big ones can have an enormous impact on young people, on their families, and on entire communities. That's why we've also committed to expanding our one-stop shop Foundry Youth Centres to 19 Foundry Centres in urban and rural British Columbia. That's why we've built mental health supports into our school systems to help more kids open up who may be struggling with mental health issues, and for them to learn at an early age, it's okay to say, I'm not okay. That's why we're also creating robust child and youth mental health teams in school districts, starting with 5 that we've announced so far. Our government's vision for mental health and addictions care is clear. We need to support youth early on, and we have to provide high-quality substance use services and care wherever they are in their healing journey. And so today's announcement is a historic step forward in our work to build a system of care that works for everyone. There's still much more to do, but we're not going to take our foot off the gas until every youth, everywhere in British Columbia, is able to get the help they need when they need it. Together, we can turn the tide on this terrible crisis. Let's continue to look out for one another. Let's continue to take care of one another. And let's continue to come together as a province to save lives.